Hello everyone, Dr. Afzali here. Today I want to share with you a segment of our meeting that every Monday I have meeting with my team, and this morning I shared one of our ortho completion cases from April 24th. Here it is. I want to share with you a success in ortho. This is our patient Teresa from Riverside. When 10 months ago, she came to see us. This is what the condition was. That was what she looked like. And 2 weeks ago, in fact, on the 24th of April, we removed her braces. And this is what she posted after her testimony that you guys saw in connecting, which was really amazing what she said. It was very thoughtful, and it would be very helpful for patients to hear it also. Then she sent me a private message on Instagram with this picture and with this message. It was really a good feeling to see that, because if you look at the before pictures, you can see the shape of the face, you can see the eyes, you can see the lips, and then this is after. So this is not just a normal result of an orthodontic work. This is way beyond that, something that I have been sharing with you, and this case is a really great case, and I'm going to go over the depth of it.
Good morning.
So if you look at the panoramic X-ray before we started it, her bite was basically the back teeth were the one that were taking the toll of the occlusion. And as a result, when you have a bite like that, then the chewing pattern becomes a horizontal pattern. That horizontal pattern negatively impacts the position of the TMJ, which you can see it in here, and also in the long term causes the grinding of the teeth. And unfortunately, the non-aesthetic effect of it is bulging up the masseter muscles, which are these muscles, and you see it in here. And patients like her, she's a skinny girl, but her face wasn't a reflection of what her actual size is. And you see the slimming and the change in the face. This is because her chewing pattern, we change her chewing pattern by changing her bite from a horizontal pattern, which would bulge up the masseter muscle, to a vertical pattern, which slims the muscles. And that's what you see, how beautiful and nice this bite came. Basically, the curve of the bite, which was reversed both in upper and lower arch, are now completely in an ideal position. And when the patient has that ideal position of the curve of the bite, then their natural instinct is to have a vertical chewing. And the TMJs are now both even. If you look at in this position, you can see the head of the condyle the distance to the skull, and then this was over jam, but now they're both in even position. And if you listen to her testimony, she's expressing it. She said, now I have a balanced bite. I never realized what is the importance of having a balanced bite, but now I can feel it. So that's a huge success, and we did it only in 10 months. And we even had improvement in the condition of this tooth that we even didn't bracket it. She had quite a bit of bone loss on the mesial of number 14, and we regained some bone growth in here. So these are the magics that we are getting, which are the opposite of the conventional stories about orthodontics. Usually when people go into orthodontic treatment, they get bone loss. They get root resorption. We don't have any of those. Her roots are all intact. We do have a balanced bite, and we have all this beauty that I'm going to continue to share with you. This bite became this bite. This canine relationship, which was completely off, became this, was restored to this. And these are the crooked teeth, which she, at this young age, she was losing gum and bone in the lower anteriors. Now they are all restored, and the lower anteriors are not. The recession of the gum is restored. And this was the palate, and that's now the beautiful arch. And that's what you see. Her, let's go back to her picture that she sent me. You see how nice and full her arch is. The third face is not collapsed anymore, is not reduced. So this is beyond orthodontics, is a facial rejuvenation. And the beauty of it is that is the best way for longevity and having an anti-aging measure, that the face doesn't collapse. All right. What do you think? This concept that I talked about it, the vertical pattern of chewing versus the horizontal pattern of chewing, was this a known concept, an old concept, or a new concept for you? I'd like to hear your feedback. And if you have any questions, just let me know. Until next time, goodbye.